One of the sad things, without getting too political, about our healthcare system is the fact that doctors and patients don't always have the last say in what's the best therapy for a patient. It is not uncommon that I'll make a decision what's best for that patient when a discussion we've had on a particular drug, only to have an insurance company say no. I don't think insurance companies have the right to do that, frankly, but I don't make the rules, right? And you get into those situations. So if there's a legitimate alternative, that's the road I usually take. And maybe drug A and B were close, and they wouldn't pay for A, they'll pay for B, fine. But if they needed A, and there really isn't a good alternative, and sometimes that's a drug called dofetilide, in our area at least, where insurance companies, for whatever the reason, it's not on their plan or they won't pay for it, or the patient has to pay a huge amount of additional money, and that may be in that patient really the drug I want them on, then the war starts, okay? Then we have to call the insurance companies. Sometimes they listen, sometimes they don't care, you know, but we try our best. If nothing works, I guess a patient can change companies, maybe, or just have to pay for it. So we do our best to make sure that patients get what we think's best for them and what they've chosen as far as their choice. But you know, doctor can only go so far. We can't force an insurance company to pay your bills. We just can't. So we can do the best we can, but we don't always win, but we do try.